In today's video, we're going to go over all of the safety information in the Abilify drug label. Hi, I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist. I used to work at the FDA. I'm an expert in drug safety. And so let's dive in. So as always, all of the information is going to be available on the government website, the NIH. This is the Daily Meds website where you can get the most up-to-date labels. And so let's dive in. We're going to hit this pretty quickly. So we're going to start with the box warning. There's going to be two risks there. One of them is for increased risk of death in dementia-related psychosis. This is class-wide. This is for all the antipsychotics. Lots of people who develop dementia may have behavioral abnormalities towards the end, some paranoia, some agitation. Antipsychotics are frequently used. They're associated with an increased risk of death when you use them compared to not using them. And so that's what they've seen for all antipsychotics, not just Abilify. Next up, we have the risk for suicide. If you've been on this channel, you know I talk about it a lot. Essentially what happens with these drugs, and like any of the psychiatric medications, is they can cause paradoxical reactions. So even though they may be calming and sedating, in the majority of people, there may be that 1 in 20 person who, for reasons we don't understand, has the opposite effect. They might become more irritable, more agitated, more impulsive. That's just the nature of taking medications that act on the brain. And so if that happens and you're someone who's depressed or suicidal already, that can push you into it. So with Abilify and any other drugs just like it, you're always going to be watching for worsening behavior that doesn't make sense in the context of the person's life. So let's go down here. So indications and usage. So what have the drug companies studied this drug in? So they've studied it they've got approval, actually. They've studied it and shown it to be effective, at least for the FDA, in schizophrenia, acute manic and mixed episodes, adjunctive treatment in depression. And so that's when someone's taking an antidepressant already, and then they put the antipsychotic on top to get essentially more of an antidepressant effect. So it's using it with an antidepressant. We've got irritability with autism, and then we also have Tourette's. And so they've gotten approval in all of those conditions. Dosage and administration. Let's just go over this quickly. This drug most commonly is going to be taken as an oral pill, and it usually ranges from 10 milligram pills all the way up to 20 milligram tablets. Mostly you're going to be starting this drug between 2 milligrams and 10 milligrams. In general, you want to start at the lowest dose possible because you don't want to overshoot and get side effects. So starting at 2 milligrams or 5 milligrams always makes sense. And then you want to go higher. Dosage forms and strengths. This drug comes, in tablets. It comes in dissolvable tablets. It comes in oral solutions. It comes in long-acting injectables. There's a long-acting injectable called Abilify Maintainer, where usually after you take the oral tablet for a while, and if you tolerate it, you could get a monthly shot. And so Abilify Maintainer lasts for 30 days. There's another form of that called Aristada. That's the 2-month version as well. And so there's lots of different ways people can take Abilify. So let's go down and let's talk about the warnings and precautions now. These are the most important side effects of the drug that everyone should know. So we talked about the first one already. This is the increased risk of death in elderly people who take this. Again, with all antipsychotics, no one really knows why it happens, but as you'll see as we go through this list, this drug does a lot of things. It causes metabolic derangements, it can cause cardiac problems as well. So there's many things that could tip someone towards death. And we're going to go into that in more detail soon. So moving through this, we talked about the suicidal thoughts and behaviors. They tend to be more common in people who are under age 25, who have those paradoxical reactions. And so let's keep on going. So, okay, here we are. So we've got neuroleptic malignant syndrome, a side effect that happens with all antipsychotics. Essentially, it causes global dysregulation of your nervous system. It usually happens when you're taking very high doses of a drug or you're taking multiple antipsychotics together. You're going to have symptoms in multiple places. So neuroleptic malignant syndrome, people become confused. They start to become tremulous and rigid. They start to have high blood pressure that's out of control, high heart rate. They can have kidney damage as well because of that. And essentially, people can go into cardiac arrest or have seizures. This is a fatal condition, potentially. If you start to have some of these things, the drug needs to be stopped and they need to be taken to hospital. So that's NMS. Tardive dyskinesia, this is an involuntary movement disorder. Usually starts around the mouth and with the tongue. However, it can go everywhere. It can go anywhere in your body. And in fact, a lot of people miss this in other areas of their body. The thing that you need to know about this is it's potentially irreversible. So after you develop this, even if you go off the drug, you may still have some of these involuntary movements. It does occur in about 5% of people on the drug per year. And so the longer you take the drug for, the higher your risk of tardive dyskinesia goes. Okay, so metabolic changes, again, not unique to Abilify. In fact, this happens with all antipsychotics. It will cause abnormalities in your blood sugar, in your lipid levels. It will make you gain weight. And so these are things that you really want to look at closely. So before you take the drug, make sure you get baseline for all of that. And then you want to be monitoring it, because if you're someone who is particularly sensitive to the metabolic side effects, you're going to want to catch that early, because as you know, metabolic changes like this, they could predispose you to problems like coronary artery disease and other things just like that. So the next risk you want to be aware of is compulsive behaviors. And so this sounds almost too crazy to be true, but this has been widely reported on. Some people who take Abilify have a strange reaction to it, where it makes them do compulsive behaviors. They'll start gambling even though they've never gambled before. They'll lose all of their money. They'll start compulsively shopping. They'll start binging. And so if you start to have these new compulsive behaviors that emerge, it may be due to the Abilify. There's been some stories on this in the news, and they're quite easy to find if you're interested. And the next thing is orthostatic hypotension. And so what this is it's when you get up from a seated position or you're lying down, and then you get really woozy and lightheaded. And the reason that happens is because your heart is unable to quickly pump all of that blood to get you to go up to your brain and for you to feel steady. So for some reason, Abilify causes problems there. And so right when you start taking the drug, you want to be a bit more cautious when you stand up. And if you're starting to get very lightheaded, you may be on too high of a dose of Abilify. This is a side effect that may likely go away over time, but you want to be aware of it, especially just at the start. This goes into falls. Okay, so this is another risk of the drug. And this is probably most relevant to older people who are taking this drug. And so it makes sense that this could cause falls if it's causing orthostatic hypotension, if it's also causing some muscular problems like rigidity when you're walking, if it's making you feel sleepy, because these drugs can make people feel sedate. All of these things will increase your risk of falls. And that's bad. You could break a hip, something like that can happen. So you want to be on the lookout for falls after you start taking this medication. The next risk is leukopenia, neutropenia, and agranulocytosis. And so these are essentially white blood cell problems. Antipsychotics, they can cause your bone marrow actually to stop producing some white blood cells. This is a rare side effect. It's not something that's commonly seen. But before you get on this drug, you're going to want to get a complete blood cell count with a differential. This will have all of the percentages of your different white blood cells. And then after you get on the drug, you may wait 3 months, 6 months, and you get another complete blood cell count. And you just want to make sure that you're not having any white blood cell abnormalities while you're taking Abilify. Seizures and convulsions, again, not unique to Abilify, can happen with other antipsychotics. These drugs can lower the seizure threshold. So you want to be aware of this, especially if you have a condition like epilepsy, as it may predispose you to seizures. So just something to keep in mind. There's problems with cognitive and motor impairment. And I think that makes a lot of sense. These are potent psychiatric medications that are strong enough to blunt strong delusions and paranoia in patients with schizophrenia. They also have a lot of movement disorders, so it makes sense that you're going to have some cognitive impairment and motor impairment on these drugs. Body temperature problems as well. Again, these are centrally acting drugs. Your body temperature regulation happens from your brain, and so if you start to have swings in your body temperature, it may be due to Abilify. We talked about suicide already. The last thing that they mention is dysphagia. These drugs, they cause neuromuscular problems, twitching, tremors, stiffness. And it's not just happening in these large skeletal muscles that we kind of run around with. It can also happen in the soft muscles, the smooth muscles like our esophagus. And so one of the problems is if you start to have uncoordinated movements of your esophagus, it can be painful and difficult to swallow. Some people may actually aspirate. And so that's when the food, instead of going down your esophagus, it comes back up and it goes into the lungs, and then people get pneumonias. And so if you're having difficulty swallowing, could potentially be due to Abilify. We're going to briefly go over some of the adverse reactions in the clinical trials. We're not going to cover all of it, but just to give you a sense of how common some of the side effects are. And so let's go down here and let's look at these short-term placebo-controlled trials for bipolar mania. So you see 900 people on Abilify, 700 on placebo. We've got akathisia happening in 13% of the people taking this drug. That's pretty high. And akathisia is a serious problem. It's this kind of inner restlessness where people kind of pace from side to side and they feel a lot of anxiety. So personally, in my experience, Abilify causes a lot of akathisia. And so it's something that you want to be looking for closely. As you can see, sedation, 8%, restlessness, 6%, tremors, 6%, other movement disorders, extrapyramidal disorders, 5%. And so that's not that uncommon. So you can come on this website and you can do a full review of what they saw in their clinical trials. So you can kind of see, how much happened on Abilify versus how much happened on placebo. We're not going to go into all of that now, but this is all available on the government website. I will stop here in this section. This is a list of essentially all of the adverse reactions that have not been discussed previously before. And then down here, we're going to talk a little bit about the post-marketing observed events. Really, there's not that much different that was observed in the post-marketing period. This means, side effects discovered after the clinical trials and after the drug was on the market. And really, it's a lot of the same. They're seeing pathological gambling. They've got, looks like some hiccups here, oculogyric crisis. This is where the eyes lock looking up. And so it's much of the same. So moving on, let's talk about drug interactions. What you need to know about Abilify is it's metabolized through the CYP3A4 and the CYP2D6 enzymes. These are groups of enzymes in the liver that process the drug. And essentially what that means is you may need to change the dose of the drug if you're taking another drug that is known to inhibit those enzymes, like slow them down or speed them up. And there are some drugs like that. For instance, strong inhibitors for CYP3A4, things like antibiotics, clarithromycin, and strong inhibitors for CYP2D6. That's you can see Prozac there, so fluoxetine. So it's just something to keep in mind with this drug. And then we also have other drug-drug interactions. So for antihypertensives, Abilify, causes that orthostatic hypotension, and it has these kind of global neurological effects that do affect the heart as well. And then we've got benzodiazepines. But I'm going to broaden this and I'm going to say if you're taking any sedative as well, you just want to be more mindful about that because now you're stacking essentially another sedating drug on top of that. And they can have this like synergy where maybe one on their own is not that potent, but when you put them together, you can become more sedated. You can have problems with falls and, operating heavy machinery and driving. So just be very cautious if you're taking multiple sedatives with Abilify. So let's go on to use in specific populations. So let's talk about pregnancy. This Abilify crosses the placenta just like all of the other antipsychotics. We don't do clinical trials in pregnant individuals with psychiatric medications. And so we don't really know for sure what happens. However, they do animal studies. Usually the animals are exposed to much higher levels of the drug than humans are given, and it does result in fetal death, problems with organs and such. And so you want to be really careful about family planning if you're taking Abilify. You may need to be on it because it's really helpful, but if you don't, it's definitely something that you want to keep in mind that the drug is going to cross the placenta. Another thing to keep in mind is this drug inhibits prolactin, which is different from the other antipsychotics, which increase prolactin. And so what is prolactin? It's what helps women lactate. One of the issues is if you take Abilify, you may produce less breast milk, and that could lead to difficulties with gaining weight for your infant. The drug also crosses into the milk, so roughly about up to 8% of the dose is going to be going into the milk and then going into the infant as well. So just keep that in mind as well. Let's go on now and just talk about the clinical studies. Obviously, this drug has shown efficacy in schizophrenia, bipolar, Tourette's, and autism. But the one thing that I want to everyone to keep in mind is that most of these studies are really short term. They're like 6 to 8 weeks long. And there really is a lot of uncertainty about whether these drugs are going to work long term for people. I'm not going to go into it fully here, but they do describe that they do a maintenance withdrawal study here to kind of prove that it works long term. But what I will say is they are poorly designed and they're heavily criticized because essentially in these studies that take maybe a group of people who have been fine on Abilify, they're doing well, they've taken it for a year, and then all of a sudden they'll get that group of 1,000 people and 500, they rapidly withdraw them from the drug and they put them on placebo, and then the other group, they keep them on the drug. And then what they saw when they did that essentially is there's more relapses in the people who get put onto the placebo, which is obvious because these drugs cause withdrawal, and these maintenance withdrawal studies, really aren't designed to differentiate withdrawal from the drug from the underlying condition coming back. And so a lot of people don't think they're really worth that much. I am one of them. And so what I will say to you, if you are taking this drug long term, there is a question mark really out there about how long it's going to be effective for. Let's quickly talk about what this drug actually does in terms of the receptors. And so the thing I want you to know is this is a fairly dirty drug. And by that, I mean it is hitting multiple receptor systems. And so we've got activity at D2, that's dopamine, 5-HT, that's serotonin, 5-HT there. We also have effects on histamine and alpha-1. And essentially, when you modify all these different areas, it's responsible for a lot of the drug effect, but also a lot of the side effects. Having partial agonist activity at dopamine, which is unusual for an antipsychotic because they usually block dopamine, that may be responsible for some of the people who are having compulsive behaviors on it, things like gambling. Alpha-1 adrenergic activity, that controls like the blood pressures, your blood vessels kind of constricting and loosening. That may be why some of that orthostatic hypotension is happening. Histamine, that may be responsible for some of the sedation people are having. And these effect on these serotonin receptors may be responsible for some of the mood or the antidepressant effects of the drug. And so that's the last thing I want to say about Abilify. I hope you've enjoyed this video. I hope it's been informative. I hope it's taught you something that your doctor didn't tell you about this drug. If you feel comfortable, I would love to hear about your experience with Abilify in the comments below the video. Thanks.